May is National Stroke Awareness Month, and it may surprise you to hear that women face a higher risk of stroke than men. In fact, the American Heart Association says 55,000 more women than men have a stroke each year in the United States. The organization also says 1 in 5 women will have a stroke in her lifetime. Here to break down why that is and what you can do about it, Dr. Leah Croll, a neurologist at Maimonides Health. Dr. Croll, first off, I think these numbers are surprising. To hear 1 in 5.
Yeah, this is really an underrated and under-recognized women's health issue. I mean, every year, twice as many women die of stroke as they do of breast cancer. So this is really something that every woman needs to know about. And the reason that a woman's risk for stroke is higher than a man's is really twofold. Number one, traditional vascular risk factors like stress or high blood pressure affect women's stroke risk more than men's. But number two, women have sex-specific stroke risk factors that they may not be aware of. So things like getting your period early, before 10 years old, having early menopause before 45, these things increase your risk for stroke later on in life. So does having a history of endometriosis, of pregnancy complications like preeclampsia, preterm birth, gestational diabetes, and even certain hormonal medications can do this.
I did not know any of that. Any of that. Is there anything we can do to prevent strokes?
Absolutely. In fact, there's quite a bit we can do to prevent stroke. So I'm going to tell you exactly what I tell my patients, which is that the first step is educating ourselves about this. We are not raising enough awareness about this really important women's health issue, and we have to arm ourselves with the knowledge of our unique risk factors so that we can go into the doctor's office and advocate for ourselves to stay on top of the stroke risk, the same way we stay on top of our breast cancer risk with our yearly screening mammograms. So depending on what your unique situation is, your doctor may talk to you about quitting smoking, about staying on top of your blood pressure, your cholesterol. And of course, everyone can do to adopt some healthy lifestyle modifications like the Mediterranean diet, increasing your exercise, promoting good sleep habits, and managing stress better. These things make a big difference.
I'm still thinking about the sex-specific indicators you mentioned, like early menopause, early, to get your period, even hormone-specific medications. But what's also interesting is that strokes can actually present differently in women. How so?
Absolutely. So, we talk a lot about this in heart disease, where we talk about women having non-traditional presentations of heart attacks. Well, the same is true for stroke. Now, in general, a stroke is going to be any sudden onset neurologic symptom. So I really want women to be aware of that time course as the most important red flag that you should get help. Traditional stroke symptoms, you can remember with the acronym B FAST. B is for balance, so sudden onset imbalance or dizziness. E is for eyes, changes in vision. F is face, drooping on one side of the face. A is arms, weakness in the arms. S is speech, slurred speech. And T is that ever important reminder that time is absolutely everything in stroke.
Dr. Leah Croll, just great data here that you shared with us, and we hope that every one of our viewers is aware of the Be Fast model, but also those sex-specific indicators you described. Dr. Croll, thank you for your time and for your expertise.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.